Hello, and welcome to my presentation. My name is Kevin Heim, and this is Two Truths and a Lie. Number 1. A parasite makes wolves more likely to become pack leaders. Number 2. Paxlovid cuts risks of long COVID, study finds. Number 3. 6 months in space leads to a decade's worth of long-term bone loss. When you read over this article, you'll find that there's a parasite called Toxoplasma. This parasite infects the brains of wolves and other animals, and it's particularly found in rodents, and studies have been seen in chimpanzees and hyenas that show similar results. The parasite found in rodents has caused rodents to lose their fear of predators. After learning about the Toxoplasma infections in wolves at Yellowstone National Park, a group of researchers decided they wanted to study the infected wolves and their behaviors. And upon the studies, they found that infected wolves become bolder. Paxlovid is a drug that is now used to treat and lessen the effects of COVID-19. The study here was conducted by the U.S. Department of Veterans Affairs, and the study was included with 56,000 veterans who were 88% male and a mean age of 65. In the study, they found that 9,000 of these patients had a 26% lower risk of developing long COVID issues. And if anyone doesn't know, long COVID issues are after effects and long-term effects of COVID-19. This study was conducted on 17 astronauts who spent between 4 to 7 months in space. Their bone mass was tracked, imaged, and recorded at 4 points in time. And the study showed that astronauts in space longer than 6 months experienced permanent bone loss in their shin bones. I chose Paxlovid cuts risk of long COVID, study finds as my lie, or more specifically as a misinformation piece. CDC and studies show that Paxlovid does reduce the effects of COVID within 5 days of taking Paxlovid. But the study here is Paxlovid on the effects of long COVID. That is the long-term effects of COVID. So the reason why I think that this is a bit of misinformation is for a few different reasons. For one, most findings for the use of Paxlovid in treating COVID are about taking Paxlovid within 5 days to reduce the immediate effects of COVID. This article here is based on one study which included 56,000 veterans with a mean age of 65 and was conducted by the U.S. Department of Veterans Affairs. Of the 56,000 very specific patients, only 9,000 or 16% had shown a lower risk. This is a very specific group of people. That's mean age of 65, and 88% of them were male. Next reason is that I think it's possible that the article is pushing Paxlovid for monetary reasons, since Paxlovid is a product of the giant pharmaceutical company Pfizer, and Paxlovid is the brand, not the drug ingredient that is effective against COVID. Another reason is that out of the other articles, studies, and websites that I looked through, they have no mention of Paxlovid when they mention long-term effects of COVID. I found this quote on the CDC website. It says, "There's no test to diagnose post-COVID conditions, and people may have a wide variety of symptoms that could come from other health issues. This can make it difficult for healthcare providers to recognize post-COVID conditions." I think that this statement suggests that the findings of Paxlovid treatment in long COVID could be circumstantial, and that other factors could be present in the results.